Hi, my name is Dexter Childs, and this is going to be my audience for tonight. I'm going to be talking to you guys about CPR, which is cardiopulmonary resuscitation. Knowing these steps could help you save a life one day. The CDC, which is the Center for Disease Control and Prevention, states that if CPR is performed in the first few minutes of cardiac arrest, it can double or even triple the chance of survival. We are going to cover the causes leading to CPR, scene safety during CPR, and lastly, the steps to CPR and why you would ever stop. I am no expert in this topic. However, I have been certified in CPR and certified to instruct CPR classes. I held these certifications for 7 years and look forward to sharing my knowledge with you. To begin with, the first point, let's discuss the reasons that lead to CPR. According to the U.S. National Library of Medicine, the most common causes of an individual needing CPR include drug overdose, heart disease, drownings, and unintentional injuries. One of the main causes that leads to CPR is drug overdose. According to the CDC, approximately 70,630 people die every year to a drug overdose. Another main reason to perform CPR is heart disease. According to the CDC, heart disease is the leading cause of death, and about 655,000 Americans die from heart disease each year. CPR can make a difference in those numbers. The third cause of reasons leading to CPR is drowning. According to the CDC, there are 3,960 fatal unintentional deaths a year. That is 11 deaths per day. On top of fatal deaths, there are 8,080 fatal drownings. The last cause of reasons leading to CPR is unintentional injuries. According to the CDC, unintentional injuries is the third leading cause of death. 173,040 people die each year to unintentional injuries. Now that we have talked about the leading causes of needing CPR, let's talk about the importance of scene safety. When you come across a victim lying on the ground, you want to make sure that you are safe before you can help the person that you are trying to help. So for example, let's say that you come across a scene and a person is lying in the middle of the road. You want to make sure that you get that person out of the middle of the road before you try and help them. That way you are safe and so is the victim that you are helping. Now that we have talked about scene safety and personal awareness, let's talk about our last point, the steps of CPR and the reasons you would stop CPR. According to the American Red Cross Association, there are 6 main steps in CPR. First is check for consciousness. So when you come across a scene, you see someone lying on the ground, you want to make sure that they are conscious. The way you would do that is you would tap them on the shoulder and ask, hey, are you okay? If they don't respond, get someone to call 911. And when you ask someone to call 911, you want to make sure that you tell someone personally to call 911. That way, not everyone thinks that someone else is going to do it. And the next step is open the airway. When opening the airway, make sure that you pull their chin back, and then you want to check for the pulse and breathing. When checking for pulse and breathing, you want to make sure you put your 2 fingers on their carotid artery, and then you want to put your ear next to their mouth, and you want to listen for breathing. The 5th step is starting compressions. You want to do 30 compressions, and what you want to do is if you look at the slide here, you can see you want to have your bottom hand flat on the victim's chest, And then you want to have your second hand over and interlapping the fingers. And then you want to push down, and you want to make sure that you have your arms interlocked, and you want to use your body weight to push down on the victim instead of your arms. When you do this, you want to do about 100 compressions a minute. And a way to do that is singing to the beat of Staying Alive. Alexa, play Staying Alive.
Staying Alive by Bee Gees on Amazon Music.
Alexa, stop. After 30 compressions, you want to do 2 rescue breaths. If those first breaths do not go in, retilt and try those breaths again. If those breaths still don't go in, the victim may be choking. The victim may be choking. Check the mouth every time before breaths for an object. If seen, remove that object. And if it's an adult, you can use your index finger. And if it is an infant or a child, you should use your pinky finger. After 2 minutes, recheck the pulse and breathing. If no changes, continue alternating between 30 compressions and 2 breaths for 2 minutes or 5 to 6 cycles. Continue this cycle until one of the 5 things happen. One reason you would stop CPR is if the AED arrives and is ready to use. 2, someone with higher training arrives and is ready to take over. 3, the scene becomes unsafe. 4, EMS arrives and is ready to take over. And 5, the victim shows signs of life. In conclusion, we talked about the leading causes of needing CPR, scene safety, and the steps of CPR, and why you would stop. I hope with this knowledge, you now feel better and equipped to help save someone's life. Thank you all for listening, and thank you to my audience. Have a great day.